Welcome, everyone, and we are here to talk to you this afternoon. And before we get started, I'll have Nadia translate.
Bonsoir tout le monde. Avant que nous commencions jeudi, Nadia traduit pour nous pendant nous parler dans la session.
Thank you so much. I just want to let everyone know that we're here this evening to talk about vaccination, COVID vaccines.
Moi, j'aimerais faire tout le monde connaître jeudi que nous là pour nous capables en parler de vaccination et vaccin corona.
Please, if you have any questions, please put those questions in the Q&A. You will find that at the bottom of your screen, and you can enter your questions there so that we can answer them.
So, nous allons faire tout le monde connaître. Si vous avez une question, vous capable de mettre dans après marquer question-réponse, vous capable de mettre vous capable taper et puis nous joindre nous capable répondre.
Thank you so much.
Merci beaucoup.
Now, before we begin to introduce our panelists, I would ask each of you to take a quick poll that you will see on the screen.
Avant que nous commencions avec les gens qui dans la présentation, nous t'aimerais à tout le monde garder questions qui dans le chat là et vous capable de répondre et vous soumettre réponses.
Thank you. So please enter your answer and we'll give you about 30 seconds to a minute to complete the poll.
So, nous répondre question yo et nous va at least en 10 secondes et puis pour nous capables à commencer.
We'll give you another 10, 15 seconds.
N'a ba ou at least 10 à 15 secondes encore.
Thank you so much. I appreciate your answers.
Merci beaucoup. Moi, apprécie réponse.
Wonderful. So 7 people voted yes and 1 said no to the vaccine.
Gen 7 moun qui répondent oui et gen yon qui répondent non.
Thank you. So we hope that we will be able to share some information with you to help you better understand the process.
So, nous souhaitons que nous capables partager bonne réponse en bonne information avec vous, qui est capable d'aider ou gain plus arguments pour capable accepter vaccin.
Thank you. So before we begin, we'll have each of the panelists introduce yourself. I am Dr. Scanterbury, a transplant surgeon, but also with a major interest in COVID vaccination.
Non, pas moi, c'est Dr. Scanterbury. C'est un docteur qui fait ça les transplants organes et il gagne un gros intérêt dans le vaccin corona.
Thank you. We'll have Dr. Julian Nadia.
Yeah. So, non, pas moi, c'est Nadia Julien, on connaît déjà. Moi, c'est un nurse practitioner de famille. Moi, elle gagne un gros intérêt dans le vaccin. Ça, moi, vraiment content pour me capable partager information. So, my name is Nadia Julian. I am a family nurse practitioner, and I got a big interest on learning more and educate others about the corona vaccine.
Rosa?
Bonsoir tout le monde, non, moi c'est Rose Simon, moi travaille avec Love and Hope Rescue Mission, c'est organisation PAM, moi travaille avec tout Haïtien, avec Hispanic qui dans Delaware, moi voyage tout côté pour m'éduquer tout le monde de Corona et pour ça pour prendre vaccin Corona. My name is Rose Simon. I am the founder of Love and Hope Rescue Mission. I go throughout the whole state of Delaware to educate and to let people know why Corona is real and why they should get their vaccination. And I'm happy to be here.
Awari?
Yes, hi. Bonsoir tout le monde. Non, moi c'est Midline Owari. Et puis moi travaille pour coalition haïtienne dans Delaware. Et puis raison qui fait moi là avec aujourd'hui, c'est parce que moi j'ai une passion pour nous capables de plus d'informations et puis éduquer tout le monde, toute population sur maladie coronavirus là avec vaccin coronavirus là. All right, I said, hello, everyone. My name is Midland Owari. I work with the Haitian Coalition of Delaware. And the reason why I am here tonight is because I have a passion with helping to spread more awareness and education about COVID-19 and also about the COVID-19 vaccination.
Thank you so much. Now, before we begin, I would like to first thank the partners that are responsible for bringing this webinar together.
Merci en pile. Avant que nous continuions, moi j'aimerais remercier tout partenaire nous qui fait webinaire ça li possible aujourd'hui.
Trinity Health Mid-Atlantic, St. Francis Healthcare.
Trinity Health Mid-Atlantic et St. Francis Healthcare.
The Modern Maternity Center, Interdenominational Ministerial Alliance. Interdenominational Ministerial Alliance.
So Interdenomination Ministerial Alliance or something. I don't know how to traduce.
H&S Impact Group.
H&S Impact Group.
Community Intervention Team.
Communauté Intervention Group.
National Coalition of 100 Black Women.
Coalition nationale de 100 femmes noires.
First State Community Action Agency.
Premier State Community Action Agence.
Wilmington Community Advisory Council.
Wilmington Community Advisory Council.
Delaware Racial Justice Collaboration.
Delaware Racial Justice Coalition.
And lastly, United Way of Delaware.
United Way, Delaware.
Thank you so much. Now we will get started, and I would like to ask each of the panelists to answer the following question. Why did you get the COVID vaccine? And Nadia, I'll start with you.
Okay. This is Nadia, and like you guys already know, I'm the nurse practitioner. I am the owner of Tabitha Medical Care. It's a clinic in Lowell, Delaware, that serves, the Haitian population and also Hispanic and African American and Caucasian, but about 50%, more than 50% of our patients are Asian. So I am so passionate about education, educate especially the fellow Haitians because of the health disparity among that population and also the language barrier. So it started with COVID and it's continued with the COVID vaccine. So the reason that I decided to engage in the COVID-19 campaign, education campaign, and also the vaccine is because I have two reasons. The first reasons, well, it's myself, as I was treating patients during the pandemic. Like I told you, about 60% of my patients are Haitian. I had a lot of patients with critical condition during the COVID that I was taking care of, and I end up being infected myself. And I spent about 10 days in the hospital, and I needed a high level oxygen. And one thing that I was really thinking when I was in the hospital, and the hospital that I went to, is a hospital that I used to work with, and the people really know me. And when I heard about, at least more than half of the patient that was hospitalized were Haitian, and they were working in the poultry plant, I said, wow. I said, I know I'm going to get out of this, but when I got out, I'm going to start my education. So, I was really sick. I was out of work for like 2 months. And then I got back to work, and I started, education, going to the Haitian churches and do Zoom and educate the population. So it's very important to me, especially with COVID. One thing, a gap that I was able to really bridge that gap. It was like a lot of our people in the community, they are very reluctant to go to the hospital, even they were having shortness of breath. So through education, we really, get a hold of them, let them know that, they're not going to kill you in the hospital. If you cannot breathe, you need to go to the hospital. Look at myself. My oxygen dropped to 85. So I went to the hospital, I received the care, and now I'm out. So now it is also the same with the COVID vaccine. And there was a lot of concern, a lot of misconception. And I decided to vaccinate so I can be a role model. So I can tell them, look, they knew, the population, the Haitian community, they really know, they know me. And I know a lot of people were praying for me when I was sick. And I make my vaccination well known, like post when I was vaccinated, and to let people know, this is the science behind the vaccines. This is how a vaccine works. And this is what to expect after you get the vaccine. As a matter of fact, I am so proud because yesterday, our first vaccination event at Tabitha Medical Care, we vaccinated about like 50 people. So that was 50 people, might be a little bit, but for the Haitian population, this is huge. So I thank God for that. And another thing too is because my mother, she was in Haiti. During the winter, that's when they usually go in Haiti. So she was sick in Haiti in July because we told them not to come, and she passed away. So when she passed away, they did not test her for COVID, but when she called me at 3:00 in the morning, told me that she was having shortness of breath. So I was like, oh my God, they didn't even check her. So after she passed, so I told, I have an adopted sister in Haiti, and then they have a lab, they have a rapid COVID test. I said, can you test all the people that was around with my mom while she was in the hospital? My adopted sister was positive for COVID, and my dad was positive for COVID. So it's really, really, those are the main things that really push me to educate people. So COVID is still there. So mes amis, comme nous déjà connaissons, so moi-même c'est Nadia, non-nurse practitioner, Paola, dans Tabitha Medical Care. So raison ça, je me suis expliqué en anglais, je m'a expliqué le tout en créole, qui fait que moi passionné pour me capable éduquer monde de vaccin, qui ça que vaccin est, qui science qui dans développement vaccin, et qui ça pour expecter leur prendre vaccin, et qui monde qui prend vaccin, qui est-ce qui pas prend vaccin, parce que comme nous connaissons déjà dans la communauté, moi-même, moi, t'ai affecté, et m'étais affecté gravement, quand m'étais passé 10 jours dans l'hôpital, moi, t'ai besoin, gros oxygène, et bon Dieu, t'ai mis dehors, et me pensais que les mettaient dehors pour une raison spéciale, pour éducation. Et maman, tout les mourir avec coronavirus. Et coronavirus, il continue à augmenter. So, c'est pour raison ça, moi-même, moi, décidé, et moi, t'es confortable avec recherche qui fait dans le vaccin, moi, prends vaccin, et m'a éduqué l'autre monde pour joindre information qui correcte de vaccin, et puis capable de prendre une décision qui est rationnelle et de pour prendre vaccin, ou bien si vous décidez de ne pas prendre, vous avez une vraie information de vaccin. Merci.
Thank you so much. We'll go to Miss Rosa. Tell us the same question to you. Why did you get the COVID vaccine? Or did you get the COVID vaccine? I'm assuming you did.
Yes, I got it. Hi, everybody. Again, my name is Rose Simon. And the reason why I got vaccinated is because, like Dr. Nadia was saying, is I had COVID not once, but twice. I deal with not only do I deal with the Haitian community, but I deal with the vulnerable population, which is the homeless people in encampments, as well as motels. So one day I went to an encampment to my organization. We bring food out to over 150 people at motels and encampments. So one day I went to deliver some meals to our folks at the encampment, and one of them was coughing and everything, and she wasn't feeling well, and I went to assist her, not knowing, forgot it was around time of COVID. I was like, you know what, I don't really care, let me just make sure she's okay. So trying to get her out of the woods and bring her into my car to take her to the hospital to get checked. Did that. When I got home, I was just having all these funny symptoms, didn't know what was wrong with me. I went into work and I was just like, I think I'm dying here. Something's wrong with me. So later on, I went to Wilmington Hospital, and they told me that I had COVID really bad, and I got admitted at the hospital. I was there for 2 weeks. I know Dr. Nadia was calling me, her and her husband kept calling me, and I was like, finally, I was able to tell them, my stories that I had it, and I had it really bad. My whole family ended up testing positive as well for COVID. Besides my mom, all of us was, out of work and couldn't go anywhere. My niece, my nephew was, 5 years old, he had it. My niece also was 7 at that time, she had it. So I was putting people around me in danger. So I was like, you know what, I think, I need to do this because I'm helping a lot of folks. I have a lot of folks that's around me all the time. I can't control what they do and where they go, but I can control myself and try to keep everybody safe. And that's when I took the initiative to continue to go out to Haitian churches and anywhere I get to speak to everybody about getting the vaccine. So that's what I've been partnering up with Westside and DPH to go around to, the encampments, the motels, to get everybody vaccinated, just to educate them and tell them the reasons why they should get it and how they can protect themselves and everybody else around them. Non, mwen se Rose, mwen pran vaksin paske mwen te afekte avek korona, mte gen korona e pa an sel fwa, mte gen korona 2 fwa, e le mte gen lan, mte al l'hopital, mte preske mouri, mpat ka mache, mpat ka pale, mpat ka manje, se peut-être sa mte vin pedi an pil poa, pou jis konya mtil pa ka manje bien, tout sa manje, pran an pil tan pou l'desan, pou l'digere, se pandan mte ap ede kek moun ki pa gen maison, yu pa gen ka, yu pa gen ken kote pi yo rete, pendant tal pote manje pa yo, se kon sa yon nan fi yo te malade, pendant mkal menen l'hopital, se kon sa li vin pran korona, mwen menm tou, mpat konen, mtap edel, mpat gen gloves, mpat gen PPE sou mwen, se kon sa tou mwen menm vin pran korona, mte afekte mal, mte fet tout fami mwen, mte reta avek sem, tan sa mte avek sem avek frem, yo tout la vin pran korona tou, se peut-être sa mte we, si bon, si mpran, mka proteje frem, sem, avec tout le monde mremen et tout le monde dans la communauté. Merci.
Thank you so much. Appreciate that. And to think that you got COVID twice. Most people thought that if you get it once, you can't get it again. So there we have a testimony that yes, you can get it more than once. Owari, Midline.
Hi, yes. Again, my name is Midlin Owari. And the reason why I got the vaccine was because I really wanted to help stop the spread of this deadly virus. And I also wanted to be able to encourage my immediate friends and family members as well to take the vaccine. And because there's a lot of mistrust in our communities, particularly in our Black and Haitian communities, and sometimes people will ask, did we're out spreading the awareness and giving out the information, and we're encouraging others to take it, and they'll ask, well, have you received the vaccine? And if you say no, then then there'll still be some kind of skepticism in their mind as to why we're encouraging them to take it, but we ourselves haven't taken it. So the reason why I got it was because I really wanted to be that example, to my friends, my family, my loved ones, that this is very important. And then also too, I had a friend. A close friend who was diagnosed with COVID, and she ended up, like Rose and Dr. Nadia, she ended up having to be hospitalized. And it really hit me hard. She was one step away from having to be on a ventilator. And she told me, that she couldn't breathe, that she really thought that she was going to die. And when I heard her story, along with the stories of a few other people that I am close with, it really motivated me to get the vaccine, because I want this to, as the state slogan says, I want it to stop with me. So that's the reason why I received the vaccine. So, alors, encore tout le monde, non, moi c'est Midlin. Raison qui fait moi te prendre vaccin, c'est parce que moi te besoin aider suspendre propagation maladie virus COVID-19 là, coronavirus là. Et puis tout, m'te besoin aider pour encourager famille moins, amis moins, tout le monde moins remet pour être capable tout prendre vaccin, parce que nous connaissons dans communauté haïtienne, il y a un pile monde qui paie pour prendre vaccin, et puis moi pense si l'autre monde ouais l'autre jeune monde avec l'autre monde docteur et dans communauté nous qui prend vaccin, l'autre monde qui gagne qui semble nous, l'autre monde noir qui prend vaccin, là ça moi pense que moun a fait a gen plus confiance et dans vaccin, et puis tout monde te gen yon zami moi mon bon ami moi était affecté avec maladie coronavirus là, il était malade vraiment grave, il était interné, il était obligé d'être interné à l'hôpital, il était gen problème respirer, il pas respirer bien, et puis il était vraiment close pour te mettre dans un opérateur, dans un système de ventilation pour aider les respirer. Et puis, il dit comme ça, il pensait qu'il a mourir. So, l'aime tant des histoires avec histoire, un pile l'autre monde qui me connaît des expériences avec virus avec coronavirus là, et puis l'aime tant de tout le monde qui mourir avec maladie ça. Moi, dit comme ça, moins besoin pour vaccin parce que moins besoin de maladie, ça arrêter avec moi. Merci. Thank you.
Thank you so much. And that was appreciate your answers. And while we have you, Ms. Owari, how was your symptoms? Did you have a lot of symptoms after your vaccine, and which vaccine did you get?
So I received the Pfizer vaccine. I did get both doses, and with the first dose, I was I felt like just kind of like, like you were sick, kind of like I came down with a cold, but it didn't last long. And, after a few days, I was able to shake it. Second dose, I didn't really have many symptoms at all. I just had the sore, my arm was just a little bit sore, but other than that, I was able to recuperate in a couple of days as well. So, pour moi-même, moi, te prends tous les deux doses vaccin Pfizer. Après première dose là, moi t'ai senti un petit genre comme bien, comme un petit genre crasé, mais après quelques jours, je devine refaire. Et puis après deuxième dose là, moi pas senti trop en pile symptômes même. C'est celle moi seulement qui était un petit genre fait mal, mais après ça, après quelques jours, moi devine refaire. Thank you.
Thank you so much. Appreciate your answers. And Ms. Rosa, since you had COVID, when you received your vaccine, how did you react to your vaccine, and how long after your COVID were you vaccinated?
After the vaccination, I got Johnson & Johnson, by the way. I'm scared of needles, so I got Johnson & Johnson. One shot done for me. When I got it, for like, I believe 3 or 4 days, my body was very sore, and it was like I had all the symptoms all over again, like I had COVID. Just the body aches, and I already have asthma as it is, so I was, struggling with that. So what helped me was, my inhaler and drinking a lot and still moving around, because I figured the first day when I got it, I was just like, you know what, I'm going home, I'm going to bed. And I did the wrong choice by that, because then it's like, it makes you lazy. That's when some of my friends was telling me, hey, you need to move around, go to the gym and move around, so your body can get used to it and you won't get sick. So that is what I did. But I recovered fully after 4 days of getting it. I was like, I felt really good, besides the body aches and everything. I still have body aches because of my symptoms and everything that I had COVID, but it's not because of the vaccine. Mte pran Johnson & Johnson nan paske mwen pe piki an pil, so mte pran an sel piki pou mte finavel. Le mte pran vaksin, mwen te gen même te fait mal tout pied, mte fait mal, mte gen même symptômes mte gen, le mte gen corona, mais il pas mal même, il te aidé man pile. Premier jour mte couché, après ça reste jour, mwen te levé, mte marché, mte lan gym nan, c'est ça qui te aidé pour me pas rester dans cabane pour un pile temps. Mais après 4 jours, mwen te bon, pas senti ken douleur rien encore.
Thank you so much. And so we'll go to the same question to you, Dr. Nadia. Did you have a lot of symptoms?
I took the Moderna vaccine after the first dose. The second day. Sorry. In the second day, I had, my body was sore. My arm was hurt really, not really bad, but I know that the pain was there. But it did not really keep me from going to work. And I already, know and prepare myself that can happen, but it was expected. So I felt, I felt tired, like you're gonna come with something. And one thing after, like the second day, I had a low grade fever, which is like 99, and I have like a swollen lymph node in that same the same arm. And after on the third day, everything was finished and done, so I did not really feel anything. And with my second dose, I feel a little tired. My arm hurt less, but other than that, that's pretty much it. I feel have a little bit of chill, but it's not something that was really big where I have to lie down. I mean, I was doing full load of patient at work, so I was able to function. And after 3 days, I didn't have any more symptoms. I mean, I still don't have anything now.
Wonderful, wonderful. And you are face to face with so many of your community. And so my question to you is, what do you see are the most common reasons for not wanting to be vaccinated amongst your community?
Yes, there is a lot. There is a lot of things. There is a lot about the safety of the vaccine more than anything else. Like the efficacy is not really a question that's brought up. The safety, it's more like, can I trust this vaccine? So can I trust the vaccine? How come this vaccine is so quick? And then the question, another question, is about the RNA messenger vaccines. So as far as for the RNA messenger to get into the DNA and altered, the DNA sequences. So after 1 or 2 years down the road, and they come up with diseases, like some people told me cancer, some younger population, the ladies are afraid about fertility. So, and also there is a big religious component about the vaccines, as far as they are people's faith and the mark of the beast. So those are those concerns. They just some of them said, I will take it, but I want to wait after a year. I want to see what that vaccine is going to do after a year before I'll take it. So those are the most common question that we have: the DNA, the RNA messenger vaccine, and what's going to happen after 1, 2, and 3 years down the road when they take the vaccines. So, and Dr. Canterbury m'a dit moi, comme moi c'est son professionnel de santé, qui question que plus commun que moi tendais et qui concerne que moun yo genyen de vaccin. So, moi dit que ça moi tendais plus, les moun gen patient yo dit yo pose un pile question sur sécurité ou bien encore safety vaccin. Est-ce que vaccin ça li vraiment est safe pour nous-mêmes, pour tout le monde dans la population? Comment fait vaccin ça li développer rapide comme ça? Et yo peur de effets secondaires vaccin. Et yo peur ça va le passer, là yo prend vaccin dans 1 an, 2 ans, 3 ans. Est-ce que papa le développer certaines maladies à cause de vaccin? Et il y a un jeune petit monde qui gagne vraiment question en peur parce que les parents pas veulent vaccin affecter et fertilité. Fertilité c'est habilité pour mon capable faire petit. So c'est plus genre de questions ça yo que nous joignent les nous demander les nous demander on question que toujours poser qui ça moun a pensé de vaccin et puis qu'on y a là nous même pour nous capable bail et réponse. So when we see patients, we always ask them, do you hear about we have the COVID vaccines. What do you think about the vaccine? Where you stand about the vaccine? I just ask an open question and to let them talk, and then before I do my education.
Thank you so much. It's so important for us as healthcare workers to really explain the process so that others can understand, to know that it is safe and that mRNA has been around for many years, since 1990. So, and that while it's a new technology, it's not going to give you COVID. It's not going to get into your DNA. And those things are important to understand.
Yeah, so Dr. Scatterberry dit nous comme ça que en tant que professionnel de santé, il est très important pour nous capables de nous faire des séances d'éducation, pour nous capables vraiment expliquer science qui gagne pour et vaccin RNA. Vaccin RNA, parce que RNA c'est une technologie qui est là depuis en 1990, so il pas vraiment nouveau, so il là longtemps et puis il pas entré dans DNA pour les capable baou et corona.
Thank you. And Ms. Rozo, in your encounters, what do you see as anything different than what Nadia said as far as reluctance to be vaccinated?
Yes, so within the services that I do with, serving the vulnerable population, a lot of the questions, like when I was with West Side on last Wednesday, and when we went to the encampments and motels, some of them were saying, when I was knocking on the door, just telling them, hey, are you going to get vaccinated? You should. It's going to be good for you. It's going to help you. And, they're like, Rose, we love you, but, I'm scared it's going to kill me, because I heard, a lot of people been saying I took it and, this person died, or they would just hear of a story, but they don't even know how accurate the story is, and they run with it. They're like, what, this person just died, is what somebody told me. They were like, my mom died from it. My mom died from Corona 10 years ago. And I'm like, really? And, it's just like their whole, their whole thinking of it is like, I don't know, why should I get it? And, so I'm not going to get it. And especially some of them that said, hey, I never had Corona, so I'm just not going to take it. Like I told them, I'm like, I understand that you never had Corona, or, you've had it, or your family had it. You should just consider, because a lot of people too had Corona, but they were, asymptomatic. So because of that, they really didn't think that they, had Corona, because they didn't get tested for it. Because a lot of our vulnerable people, including the Haitian population, is that they don't believe in getting testing. It's like, you have to persuade them. I've worked with, Curative and DPH to try to work with certain Haitian churches for Curative to come out to, test the Haitians. And a lot of them are telling me, the pastors are like, we don't have Corona, why should we get tested? We'll just drink ginger tea, ginger tea and certain stuff, and, it'll go away even if we have symptoms. So those are some of the things that I've dealt with. And it's just like Dr. Nadia was saying, is the, re-education, just, reassuring them that, hey, just listen to me. Maybe I can change your mind with something I would say based on my story. I've used my story to help persuade a lot of the people that I have encountered with, because they listen to me a lot with what I say. So once I told them, like, hey, you know what happened to me, and you saw my pictures and everything. So when they think about it, a lot of them was telling me, I'm just doing it for you, Rose, because I want you to keep, helping us and stuff like that. So those are some of the encounters I had. Comme I've dit à tout le monde, les m'a parlé de corona, les m'a dit mon puis prend vaccin, yo toujours dit me consacrer pour ça puis prendre parce que yo pas de corona, ou bien famille yo pas de corona, si yo malade yo ka brete bagay ça yo. Donc ça me fait les m'tendre histoire ça yo, moi juste parler avec yo, moi éduquer yo, moi dire consacrer, même si ou pas de jamais gen corona, ou une famille ou pas jamais gen corona, mais prend vaccin parce que la aide ou la aide des monde qui a yo, famille ou petit tout le monde, parce que pas connaît qui est soit marché à côté et monde ça ka malade bien mal, après ça va dans magasin ou manger bagay ou ka prend maladie comme ça. Donc c'est comme ça, moi juste parler avec tout le monde pour encourager tout le monde, même si on pas le faire, avec un peu d'encouragement nous ka faire arriver. Thank you.
Thank you so much. And it is understandable that there is that distrust, and they want to know why is it so quick to come to play in terms of this vaccine availability. But I think the one thing that's important to understand and to tell your patients and those who you come in contact with is that we now have people of color involved in the process of this vaccination rollout. And they look like us, and they're there to also make sure that the stuff that was being done is validated.
So, c'est très important, les nous parler avec monde que nous rencontrons, pour nous capables de dire comme ça que, qu'on est là, nous gagnons vraiment un monde qui sorti dans ethnique, nous, dans ethnicité, nous, bien monde, ça aurait les aux États-Unis, people of color, tant que monde qui, tant que nous-mêmes, haïtiens, black, qui involve dans le process là tout. So, qui involve dans le process, ça veut dire process et développer un vaccin, pour capable make sure que tout groupe et ethnique groupe yo représenté et puis capable augmenter ça les confiance et monde qui dans minorité yo. So yeah.
And so many of the people also are reluctant, like you said, they want to make sure that this isn't going to cause something down the line. Mm-hmm. But as I tell people, if you catch COVID between now and then, while you want to wait a year or 2 years, then you may die from COVID. There are no reported deaths from the vaccine directly related to the vaccine. And one thing that I do see is that people come and get their first dose and develop COVID because they were already exposed to it. So it's not like they got COVID from the vaccine.
So, yon nan bagay ke mwen wè ke les moun ki vin pran vaksin, et après, yo pran vaksin, yo testé positif pour corona. Ça va vle dire que vaksin ba corona, parce que vaksin pa ka ba corona. So, si que yo te gitan exposé avec un virus lan, yo kapab vin testé positif. So, li très important, les nous apé en fait genre d'éducation ça yo pour nous capable make sure que moun yo connaît ça et leur prend vaccin li protège ou contre complications que corona capable faire. So si vous dit que faut pas prendre pourquoi prendre vaccin et pendant ce temps ou attendre ou capable infecté avec corona.
Thank you. And Ms. Awari, you said you received the vaccine because you wanted to be a model and to show others that they can trust that this is something that's good to do and is important to do. So in your arena of the people you are around, what do you see as the most barriers that they think are what's keeping them from getting vaccinated?
Yeah, so like the other panelists, I hear the same concerns, mainly fear that if they receive the vaccination, that that they could potentially die from it, and also fear that even if there is not immediate symptoms, or that they don't die from the vaccine immediately, that maybe later on down the line that the virus can affect them in some way. And also, as Ms. Nadia mentioned, with a lot of people have a religious, there's a religious component to why they don't want to take the vaccine. They feel like it is, the mark of the beast. And they feel like this is, a revelation that is taking place with vaccine. And they also have a mistrust as well, too, of the government. That they feel that the government is out to get them, or that the government is putting something in these vaccines as a way to control.
I think we've lost you there a second. She was talking about how the government likely.
I think she's frozen.
Yeah.
Yeah, I'm just going to piggyback with what she was saying, because the same thing that she's saying, a lot of us are hearing the same thing, is that, they think that there's a microchip in the vaccine that, it's like to link to where the person is at. So that's why I'm not going to get the vaccine because of that. I've heard it with some of, the Haitian and Hispanic community telling me, Rose, why should I get this vaccine when, there's like a map in the vaccine that's going to locate where I'm at so they can, trap me. And a lot of our people, foreigners, is like the biggest fear because of their legal status, the status that they have in the United States. They're scared that something is going to happen to them if they get it, because they're giving their information. And that is why I've taken the upon myself to host some vaccination clinics at our church, where I know I let them know that, reassure them that, hey, you're safe, nothing's going to happen to you, and we don't ask you for no ID, you don't have to show your address or anything like that, and nothing is going to happen.
Okay, Midland.
Yes.
Okay, are you, yeah.
Yes,
I
apologize, okay. Everyone. Yes, I am. I wanted to go ahead and repeat what I just said in Creole, and Rose also too. I heard that Rose was elaborating on some of the things that I talked about. So, raison qui fait moi-même et avec une expérience moins avec travail communautaire, j'entendais un peu le monde dire comme ça que yo peur pour un vaccin parce que yo peur que si yo prend vaccin yo ka mourir, ou bien si yo pas mourir et immédiatement que vaccin a affecté système yo, même si c'est pas immédiatement, mais à un point vaccin a affecté système yo. Et puis tout, il y a un peu de monde parce que religion yo, parce que qu'on est un place chrétien yo dit comme ça que vaccin c'est Macbeth là. Et puis tout, il y a un peu de monde qui pas fait gouvernement confiance. Yo pense vaccin c'est un genre pour gouvernement qui contrôler yo. Yo pense que y a mette yon chip ou bien bagay nan vaccin côté gouvernement pas connaît exactement côté oye qui ça va faire. So bien pile et moun qui pas fait vaccin confiance. So dans expérience moi c'est ça moi ouais.
That's good. That's good, Dr. Kimberly. Scatterberry, what Midlin and Rose were saying, because I have a radio show that I host, and one of the things that we talked about was the chip. So I had to really let them know it's the chip. It's like a GPS system that's in the box of the vaccine because of the requirement of the temperature for the Pfizer vaccine. So the chip doing traveling, so they can, to make sure that the temperature remain, because remember that vaccine is expensive. So they have to make sure that the temperature is maintained through travel from the distribution sites and to the location that the vaccine is going. So because we had a lot of questions when they call about, the chip. So, and some of them said, oh, wow, I did not know that. I thought the chip was inside each valve and that's going to control, everything about us. And I told them, the government already know everything about you. So yes, that's one thing that I told them.
Especially if you have a cell phone.
So, yes, especially with a cell phone. So I told them that. So, pour m'capable dire ça, Midlin just dit, pour un chips là, que yo parlé en pile de li, nous te dans radio que dans show que nous gagnons et aller dans faire éducation, nous toujours dit moun yo, surtout dans vaccin Pfizer qui mandé une température de -70, li important pour yo capable mettre ça au relais, yon GPS système. Un système GPS pour être capable de contrôler vaccin dans distribution côté le sorti dans site manufacturer pour le arriver dans le local côté li pralia pour yo make sure que température là li rete à niveau supposé pour vaccin pas gâté. So c'est peut-être ça que vous mettez, mais pas gagner vraiment yon chips dans chaque bouteille vaccin qui produit. Merci.
Yeah, thank you so much. Because one thing that we do not realize, and we talk about the long-term issues with the vaccine, but we know there are long-term issues with corona.
Mm-hmm.
And the fact that when we think about we lose our smell and our taste, you have to understand it's because it's in the base of your brain. This virus gets throughout all your body. It's already in your system. So corona is the devil, if you want to think about that way, because it's getting from your brain to your lungs, to your liver, to your kidneys, causing blood clots. The long-term fare should be COVID and coronavirus.
Yeah, so li très important pour nous capables connaître. So li dit que et Satan c'est corona, c'est maladie parce que li attaquer tout système, li attaquer cerveau, li attaquer poumon, li attaquer en rein, li attaquer foie et li vraiment gagner complications qui néfastes ou capable perdu habilité pour goût et aussi habilité pour capable prendre sang. So ça veut dire que et virus là en soi c'est un diable que lié en soi. So c'est pas comment on dit ça, c'est pas vaccin qui c'est une façon pour capable protéger tête ou contre complications virus là. Pour les capables faire ça. So I just want to piggyback on what you just said, doctor, because I had a young patient. So no big comorbidity. He has high blood pressure, but he spent 104 days in ICU. And that young patient, he got out, but he's currently disabled.
Yes.
So I take that example a lot with the Haitian community because he's in our community. So the patient, it's kind of like our patients. The complication of this deadly virus, it's one of the major concern that we should focus on. As I always tell my patient. So moi dis que vaccin ou bien encore complication de violent virus ça, c'est un bagay pour nous capable vraiment penser sur lui. Là, comme m'a dit, moi, j'ai un patient, il passé plus de 104 jours dans critical care ou bien en bas machine. À chaque fois, il vient plus retirer la machine, et puis parents dit non. Mais li refait, but li a un pile effet négatif de virus ça, et actuellement, il n'est pas capable de fonctionner, j'en ai qu'on fonctionner. Ça veut dire, virus là, mes amis, c'est un diable qui a ravagé nous.
So I'm just going to add what Dr. Nadi was saying about that, because I have my cousin-in-law, my sister's husband's nephew. He had COVID and he's young. He was 21 years old, and he had it. He was in the hospital. He told me he died like 4 times in the hospital, and because of his weight and all the complications that he was in the hospital for close to 100 and something days too, as Dr. Nadia was saying. And with his story is he couldn't talk, he couldn't walk and everything. He went to rehab, he couldn't do anything. He was literally doing everything on himself, and he still is not able to walk completely. He walks with a walker. His life is on hold, not being able to go to college and do a lot of things. So, for a lot of young people like us that don't think COVID is real, it's very real, and we should really take it serious. Even though we're young, we think we can party, we can do different things. We should reconsider and be safe, because he didn't know that was going to happen to him. He was at the wrong place at the wrong time, and he brought it to his whole house. But fortunately, the household members were good, but he was in the hospital for some time. Yesterday made 1 year anniversary. I think they celebrated that he's been out the hospital, but he's still in the recovering mode. He still has, some memory loss issues that he's still facing.
Yes, and that you're going to translate. Sorry.
So, moi ta dit comme ça que ça Dr. Nadia dit c'est vrai. Moi gen un cousin qui gen 21 ans, li te gen corona, pour jusqu'on y a li gen difficulté avec pour marcher, pour manger, pour faire tout bagay besoin moun faire pour li pas ka faire rien pour tête li était dans rehab, li était dans nursing home, il était passé en pile temps, il était mort presque 4 fois, et qu'on y a la il a essayé pour marcher, pour faire tout ça qu'il a fait pour contre lui, mais il était difficile. Ça m'a dit un pile jeune monde tant comme pas ouais parce que jeune nous pense pas prendre corona ou pas jamais gagner, faut faire attention parce que pas jamais connaît qui est-ce qui marche avant ou aller non fait ou bien à l'autre côté, après ça ou vient malade ou porter la caillou ou même tout vient affecté ou pas jamais connait ça qui arrive. Juste protéger tête ou protéger monde qui ou remet en pile. Merci.
And we know that regardless of what vaccine you get, they're all are 100% protective of keeping you from dying. While we must realize that nearly 3 million people have died from corona across this world. You're on a mute.
C'est vraiment important pour nous capables de connaître parce que quel que soit le vaccin que vous décidez pour prendre, dans 3 ça qui gagnent autorisation pour utiliser aux États-Unis, ou capable de protéger tête à 100% de mourir ou bien dégâts de coronavirus là. Et pas oublier que coronavirus là gagne à peu près 3 millions de monde qui mourent de en corona. So, c'est très important pour nous capables faire ça, nous supposer faire ça, nous qu'a fait pour nous capables protéger tête non.
Absolutely. And we know that the vaccines are effective. We know that the longer we have more people not vaccinated, the more mutants we will have.
Oui, nous connaissons so vaccin li effectif et plus temps apprend pour plus monde vacciné, c'est plus chance que n'a bail pour nous capable gagner plus mutation qui fait dans virus là parce que virus c'est ça virus fait virus limité ou nous connaît gagner plusieurs l'autre strain cap vini ça veut dire que plus nous protéger tête nous plus bonheur, plus nous capables stop et mutation virus ça.
We know that there's a question about the vaccine and the variants, and we know that Johnson & Johnson was tested in South Africa and has a very high efficacy, effectiveness against the South African variant.
So, nous connaissons que et vaccin yo protégé nous, but Johnson & Johnson non, dernier vaccin qui fait sorti il était testé en Afrique et nous connaissons gayon strain et dans virus là ou bien encore une mutation qui sorti en South Africa. So Johnson non, il était testé et li positif, la veut dire que li gen positif effet dans variant ça, dans mutation ça qui était sorti en Afrique là.
We also know that Pfizer also has effectiveness against the mutants, and Moderna is still does offer some protection, but their research is still underway.
So nous connaissons que et Pfizer li montré que li gagne protection pour quelques mutation qu'a fait là et Moderna li gagne recherche qu'a fait pour capable regarder est-ce que li still effectif dans quelques mutations qui fait dans virus là.
And if there are any other questions from the audience, please put them in the Q&A chat, because it's important that we answer your questions. Remember that any vaccine is better than no vaccine. And even if the vaccine is 50% effective against the variants, that's 50% more than you will have if you don't get vaccinated.
Yes, so li di pa oublier pour nous capable mettre question nous dans question réponse là, taper et changer que tout vaccin que vous prenez, il est très important et quel que soit vaccin que vous décidez prendre, les plus bon que si vous pas prendre rien parce que même si que il gagne 50% pour effet de mutation, c'est 50% que vous avez gagné moins chance pour capable de gagner mutation. Même si ça 50%, vous supposez faire ce bien pour faire avec vaccination.
Thank you so much. And as we come to the close of the hour, before we close up, we would like to ask the audience to take another poll for us.
So, li prêt pour nous capable aller, so, on a demandé audience yo konye, yo capable répondre question ça yo pour nous encore.
So please put your answer in. We still have the 10 people on the line. Let's see if we get 100%. And while we wait for this to be completed before we go, is there anything each of you would like to tell anyone who is on the fence about the vaccine? Is Nadia?
Sorry. Yeah, I'm still there. Yes, so I would really like to, like tell people it's very important as far as the science. That's the reason why, as we started the education campaign, to the churches. Like next Sunday, I'm gonna go to a church for education. For an education session about the vaccine. So that I always tell them, ask any question. ask any questions so we can try to clarify it. So please, I mean, it's very important to vaccinate. So a vaccine is a prevention. Every time that we have an epidemic or a pandemic, so vaccine is not something that just happened. It's been years and years and years. Like I always tell, people, when we had a tuberculosis epidemic in Haiti, so they developed that vaccine that they give in the third world country, the BCG vaccine. So I mean, tuberculosis used to kill so many people in Haiti. So now we don't have that much anymore, because when the kids is born, the first vaccine, I always joke with my patient, we have that mark. We have that mark in our arm. So it's a good thing. So vaccine, it's something that it's always underway. Every time we have a pandemic or epidemic, the researchers, the sciences, that's what they do. So I really, that we are available. So to educate, and any question that you have when you come to the clinic, when we go to the churches, everywhere, when I'm in the market, I mean, just stop me, and then we would try to talk to you. So, nous dit comme ça que c'est très important pour capable connaître que vaccin, c'est un bagage qui était toujours là depuis des années, centaines d'années. Chaque fois que nous avons pandémie, épidémie, scientifiques, ils mettent tête ensemble pour capable développer un vaccin pour capable stop les problèmes. Non? Même gens longtemps, tuberculose est qu'on tuait en pile monde Haïti. So, c'est scientifiques qui étaient pas Haïti seulement, excusez, dans le pays sous-développé. So, c'est ça fait qu'on y a un vaccin qui est le vaccin BCG, ou est que des pour sortir dans un third world country, ou bien un country qui pas développé, yon nan bagay que les timoun nan fait yo bali c'est vaccin BCG pour capable protéger contre tuberculose. Nous toutes nous gen marque là, so nous te prendre. So vaccin corona, so c'est même c'est une pandémie qui fait que les développer. So là nous passer l'église yo mes amis, ou bien sur web dans market, sur web dans la rue, quelle que soit question que ou ta gagné pour vaccin, en fait, nous connaissons. Et nous, là, pour nous capable de vérité, nous ne va pas dire que l'on prend vaccin tout bagaille pour l'eau, pas bien aucun side effect. So, ou a bien side effect. Par exemple, hier, nous avons vaccin, il y a des gens qui ont un petit fièvre actuellement avant de venir pour me là parce que les me disent qu'ils ont la fièvre. So, ça, you expected. Ça veut dire, quelle que soit la question que tu as gagnée, ou pas besoin de peur, ou mettre poser et nous là pour nous répondre. One thing I said I forget to tell them. So like I mean I'm not gonna tell them they're not gonna have like side effect like we were talking about, fever and chill. As a matter of fact, as I might go into my meeting, so one of my patients that I vaccinated, her daughter called me in my cell phone they have my cell phone and my cell phone, so that patient had a fever, they're gonna go to the hospital with them. So after I'm done here, I'm gonna call them and reassure them it is expected, even though I did a video to let them know this is what to expect, but I'm gonna have to call them, let them know, take some Tylenol, drink some water, it should go away in a couple of days. So I mean, we are there to educate. Thank you.
Thank you so much. We come to the end of the hour plus a few more extra minutes. I thank you for being on the panel. I thank all the viewers for participants for coming on. This was a wonderful session. I hope that we actually had 100% on the repeat poll, so that's wonderful. We capture one more person. And I hope that you are successful and continue to do all the great work you're doing in your community. One by one, we'll get each and every person vaccinated, and hopefully they will feel better and they'll pass it on to someone else. So I appreciate you being here this evening on this United Way program, and thank you each and every one of you. And if there's anything I can do to help you out in your community, please let me know. But you all seem quite knowledgeable and able to carry on your cause on your own. So thank you again, and have a good night.
Thank you.
Thank you.
Thank you so much, everybody. Everybody have a blessed night.
You too.